Good morning. I am Scott Hara, Director of Digital Content at UMHS, and today we're speaking with UMH graduate Dr. Mwamba Malekani. Dr. Malekani, good morning and welcome to you today.
Hi, good morning. How are you?
Great, thanks for asking. Can you tell us a little bit about yourself and also where you're doing residency and where you're originally from?
Sure. So my parents are from Africa. My mom is from West Africa. My dad is from Southern. I grew up across the US, throughout the Midwest, and most currently in the Northeast. I am going to be doing my psychiatry residency training at Authority Health in Detroit, Michigan. It's affiliated with Michigan State University.
Okay, great. And can you tell us a little bit about why you chose UMHS over other medical schools?
Sure. So in particular, when I was deciding on Caribbean med schools, a big thing that was um, home to me was making sure I went to a school that cared about their students and not just the numbers per se. I had a friend from undergrad who was currently attending UMHS, and so I was able to ask them a lot of questions in particular, in addition to talking to the staff and faculty when I was interviewing for UMHS. But a big thing that rung home to me was basically the idea of there's a lot of closeness within the community on campus on the island, and the ability to talk to professors. It was a much more open door policy. And I noticed the class sizes were much smaller than some of the other schools I was looking at.
Okay, great. And did you always want to be a doctor? I mean, what was your undergraduate background in?
Sure. I have always loved math and science. Um, and in high school in particular, I decided on going into medicine. So one of the photos I actually shared with you is me and my primary care physician from high school. I expressed my interest in medicine to her very early on, and she actually had me work in her family practice office as a high school student, and then I would come during vacations during college. So that really exposed me from the start to becoming a physician.
Okay, great. And were there any professors or staff members in UMHS, both in St. Kitts and Maine, or even in clinical rotations, that you found especially helpful or inspiring to you?
Sure. In particular, I would say all of the professors, just in general, when we were on the
Hmm.
island, were very helpful. Of course, everyone has like people who they pull towards more just because of personalities or certain learning styles. I would say, in particular, our anatomy professors initially, so Dr. Purcell, Professor McCracken initially. As we went on, I really enjoyed biochemistry with Dr. Mungley, pathology with Dr. Roy, and then I would say something that one professor who kind of sparked my interest in more of the neuroscience realm was Dr. D initially. And I mean, I can elaborate on that more because my decision to go into psychiatry was a bit later than most people. But I think the initial starting point was probably in neuroscience on the island.
Okay, great. And you said that was Dr. Dean?
Dr. D, sorry, Dr. Doherty.
Oh, Dr.
Yeah.
Doherty. Oh, yeah. Oh,
Yeah.
yes. The late Dr.
Everyone calls
Doherty.
him Dr.
Yes.
D.
We miss him so much. Definitely. I know he inspired a lot of people. And is there, could you tell us a bit about your upcoming residency and why you chose to go into psychiatry?
Sure. So I am going to Authority Health. Their mission and work there is particular to work with patients who are underserved. And I know that's kind of a growing movement right now in medicine,
Right.
helping folks who are in more underserved positions, whether rural or urban. So Authority Health's focus is more of an urban um, environment. In addition to that, when I was looking at programs, that was kind of a big selling point for me with Authority Health. As far as why I went into psychiatry, again, it was definitely something that I came to a conclusion on much later in my medical school journey. I initially had a lot of interest in more of like the surgical specialties, and I think I can credit that to the anatomy professors on the island.
Right.
Going through clinical rotations, I really enjoyed pediatrics and I also enjoyed neurology. Um, and what I came to realize after the fact a bit later is I think a lot of my own stigma about mental health care kind of got in the way of me deciding on psychiatry. Um, However, once I was able to learn kind of what it would take to become a psychiatrist, and ultimately my goal is to become a child psychiatrist, it was a perfect blend of pediatrics and neuroscience for me.
Wow, that's amazing. So you want to serve medically underserved communities
Mhm.
in psychiatry, and I know in all communities there's such a stigma on mental health, and it's so great that you pointed that out. And we really need more people like you to go into psychiatry because I think mental health is so important right now. Do you have any advice for current or incoming students about attending UMHS and also the match process?
Sure. So as far as while you're attending UMHS or any medical school in general, I think the advice that most folks give is pretty sound, to stay focused, maintain kind of just what's ahead of you at the time. It gets overwhelming when you're thinking a lot of the big picture of the match when you're ideally just an EBS 1 or Med 1, and that can be extremely overwhelming. So definitely staying focused and just trying to do the best you can in the courses at the time. However, I will say while you are going through medical school, it's always good to do things outside of medical school that enrich your experience and also help you remember your why. So something I was pretty active in when I was on the island was like quite few of the health fairs. Um, I did a lot of health fairs through Student National Medical Association, otherwise known as SNMA.
Right.
And that was a helpful reminder when I finished a block exam, we were doing a health fair in the community and just remembering what we're doing and why we're studying so much in biochem and what the ultimate goal is at the end. As far as the match goes, I would say try to find a mentor and try to find someone who can also sponsor you because the match process, it can be challenging, of course. And at the same time, I think it's important not to try to reinvent the wheel when you're going through the process. Um, and how you find a mentor can be through your clinical rotations, it can be through advocacy work you do, it can be through any sort of extracurricular. Um, but there is an important point of knowing the distinction between a mentor and a sponsor. So, since graduating, I've worked at a psychiatric hospital in outside of Boston, and I found a mentor there. And she actually is one of the few Black psychiatrists in the country. So,
Wow.
Black physicians make up only about 2% of the physician population. And in psychiatry, of course, it's roughly the same. About 2% of psychiatrists are Black women. So my mentor there, Dr. Sophia Moras, has been really helpful. She's really helped me kind of figure out the path in terms of what to do in terms of the match. Um, in addition to that, I've had a research mentor who has been quite a sponsor for me. So he was able to facilitate advocating for me to certain programs and helping me with the match process as well. So it's important to find those types of people on your side as well while you're applying.
Most definitely. And I know we're trying to build upon the mentoring and advocacy for our alumni. So that's really great that you were able to have people to kind of supporting you. And also, I know Patrick McCormick in our academic affairs department said really great things about you. And you recommend that people also follow the advice of Patrick McCormick in his department.
Mhm. Yes, I definitely do. I think a lot of the emails we get and roadmaps, of course, that really helps you know how the match process works in general. So I think that was extremely helpful.